to, yeah, now the record is in progress. And I will ask you to, if you can, switch off your camera. First, switch off your microphone too. And I will give the word to Pavel, the organizer of this webinar series. Pavel, the floor is yours.
Thank you, Danny. Hello, everybody. Here, Paweł Kawalek, Working Group 4 leader. I would like to welcome you to Enota's sixth webinar on pharmacoeconomics. The entire webinar will be recorded and will be available on the Enota YouTube channel soon. Today's webinar is one of a series of webinars. We have planned a total of 10 webinars, which we started in the beginning of this year. In February, we had the first one, and the next meetings will be held in the following months, as you can see, until the end of this year. Each webinar will last 30 minutes with approximately 20 minutes for the presentation and 5 to 10 minutes for Q&A session and discussion. Title of today's presentation is Cost of Illness and Budget Impact Analysis. And the lecture will be given by Dr. Mehtap Çakmak Barsbay from Ankara University, Turkey. Mehtap is an associate professor of healthcare management at the Faculty of Health Sciences, Ankara University. Her research interests focus on burden of disease, evaluation of health policy and politics, and program assessment methods. She teaches health planning, comparative health systems, and health economics in several programs at her university. So, Mehtap, please start your presentation. The floor is yours.
Thank you. Hello, everyone, and thank you for attending today's session. Let me share my screen. Yes, today I'll explain you some basic details of cost of illness analysis and budget impact analysis. They are two important tools of economic evaluation techniques. And let me first explain cost of illness analysis. It has some relations with budget impact analysis. As you see, we compare current situation and new tax. This can be a new method, this can be new tech or new intervention. So we could compare their costs regarding a specific illness, and by calculating the difference, these methods, we will conclude on budget impact analysis. So I'll explain some steps of cost of illness analysis. Firstly, we should set our purpose. We should start by definition. What should we compare? What should be a benchmark? And then our perspective is really important. Generally, health system or payer perspective, and sometimes pharmaceutical companies' perspective can be included in this analysis. And if we want to combine all of them, then the perspective is according to society, it combines them all. And then we should go with the specific disease, and then we should decide cost analysis approach. This can be incidence-based and or prevalence-based. And then cost analysis method, we should conclude bottom-up or top-down method. And then we should list the costs, tangible, intangible costs, according to our perspective. And we should collect data and analyze and report our results. Cost of illness analysis is related to who bears the costs and who enjoys the benefits. So how long costs and outcomes are measured and what costs and outcomes are included? These are the main questions when we are focusing in cost of illness analysis. As I said earlier, study perspective is really important, a good starting point with determining study perspective in a really detailed way. It's a viewpoint from which an analysis is conducted and refers to which costs and benefits are included. This can be a government's perspective, payer perspective, even a patient's perspective. And as I said, if we combine them all, society perspective is the most general one. When we calculating costs, we should discriminate direct medical costs and indirect costs. Direct costs generally refers to the costs of diagnostic tests, drug costs, physician office visits, biologics and medications, surgery, hospitalization, these kinds of costs. And as you see here, the major contributors of the total health expenditure of Crohn's disease were biologics. It's 5,000 euro, and medications nearly 3,000 euro, followed by hospitalization 2,000 euro, and surgery it's less than hospitalization, but it's very near to 2,000 euro. And we are going with the direct medical costs. In Portugal, the annual average cost per IBD patient is 6,000 euro. It's 60% is related to Crohn's disease and 40% to ulcerative colitis. So direct costs are easy to calculate, but indirect costs are not easy as direct costs, because they include productivity losses and every kind of costs, especially we cannot turn them into monetary units. So indirect costs include every kind of impacts of patient and caregiver participation in an intervention. So these costs are generally much more complicated to measure than other kinds of tangible costs. You see a publication here exploring work productivity loss in patients with inflammatory bowel disease. In this article, it was aimed to evaluate the impact of inflammatory bowel disease on patients' professional life and to determine predictors of severe work productivity loss. And when we looked at the results, we see absenteeism were calculated. And in multivariate analysis, these work productivity loss in these patients are analyzed and reported in results. And budget impact analysis is a kind of estimation the financial consequences of any kind of intervention or new drugs. And we should calculate and we should see the financial impact on annual healthcare use and costs for the first, the second, and subsequent years according to our time horizon. It can be 1 year, 3 year, 5 year, and ISPOR suggests that it can start from 1 year to 5 years. So according to your model, according to your time horizon, these estimates should exceed to 5 years. Budget impact models rely on robust estimates for market share also. Market share uptake of the new therapy or intervention being introduced. These therapies are highly costed, so we should know if we can afford these kinds of drugs or interventions. So in terms of patients' view, in terms of insurance perspective and healthcare policymakers, and for evidence-based decision making, these affordability decisions are really important for to pay for them or not. So if we are coming across with new therapies, every new therapist should follow with budget impact analysis to see these informed decisions. Budget impact analysis is a tool to forecast the impact, and it has many approaches, many forecasting methods on a new intervention on payer budgets, and takes into account the whole healthcare system in a national perspective or in a regional perspective according to your setting. And it provides us a benchmarking for evidence-based decision making, because if we know it's cost effective and it's affordable, we can conclude to reimburse this new drug. For this reason, reimbursement decisions should rely on these kinds of analysis, especially new drugs and new medications, new methods for reimbursement agencies. There are some national guidelines, and they set all the details in these guidelines. Some countries like Belgium, like Netherlands, they have some specific, like Canada, they have budget impact analysis methods in details, especially for pharmaceutical campaigns for their new drugs. When we are doing budget impact analysis, firstly, we should estimate the eligible population uptake. So we should know who are suffering from this disease and the population suffering from this disease. And we should select the time horizon. It can be start from 1 year to 5 years. And then we should identify current and the new projected treatment mix, and we should benchmark and compare the two of them. And then we should estimate current and future drug costs and disease-related other kinds of costs like surgery, hospitalization, or every kind of costs, as I said, productivity loss costs also can be included. And estimating and presenting changes in annual budget impact and health outcomes. These are the main steps of budget impact analysis. There are different approaches in this analysis. The first one is epidemiology analysis. We should start with prevalence or incidence, defining with the population, like PICO's questions. What's our population? And we should have real-time data on the share of the treated patients. And then we should know the healthcare resources and the related costs, especially associated with this disease, hospital visits, the duration of the visits, duration of the hospitalization, surgery, if it should exist or not, outpatient appointments, TDM tests, the counts of these healthcare resources. And the other one is market analysis, estimating market share. It's important for pharmaceutical companies. It's important for new drugs. Also, analysis of the costs of the treatment. These are the 4 key variables. In any of them, we should take into consideration the cost components like unit drug costs or monitoring and administration of this drug, that's subcutaneous or intravenous, or how should we implement it, possible adverse events related to these drugs, and disease-related healthcare utilization, diagnostic, hospitalization, surgery, or outpatient visits. Firstly, these should be with cost-effective analysis. They are combined. We can't distinguish the two of them from a cost-effective analysis. There are some common steps, common methods, some distinct features, distinct characteristics. And as you see, perspective and time horizon, we should generally use payer perspective, because if we should conclude with reimbursement decisions, payer perspective is it's okay. But so if we, for example, NICE and many countries recommends everyone not to use only a payer perspective, rather society perspective, rather the especially intangible costs are really important. For this reason, they want to include all the productivity laws or other intangible costs. So when we want to design the characteristic of the disease, what's the type, what's the situation in the society, what's the current and new treatment, what's the characteristic of this disease, the epidemiological characteristics, and also we should know about the health system, especially financing measures are important, and scenario analysis are important. What are the existing treatment modalities in scenario analysis? We assume some different scenarios, some possible costs relate to this disease, and then PICO questions, population intervention, comparator outcome, and settings. Population is the target population. we should decide eligible population for treatment with the new alternative for patients suffering from this disease. And we should have some data sources, especially for epidemiologic nature of this disease, and market share should be determined among eligible populations and existing alternatives. And costing steps include all eligible costs, induction, maintenance, follow-up costs, and discounting and sensitivity analysis. Generally, in budget impact analysis, no discounting is applied because discounting is meaningful in longer horizons, especially for lifelong period. But we should calculate all the costs for 1 year or 3 years. For this reason, no discounting is relevant in budget impact analysis. And first market product. This is one of the 4 variables. This concept is the first of its kind to enter a specific therapeutic market. It's relevant for a novel therapeutic class, especially important for first biologics in its indication. And as biosimilar, that's the first to challenge a branded biologic. And there are some approaches. Market share can be estimated in terms of units or sales, and top-down and bottom-up approach can be applied. And we should get data related to the consumption characteristics, and then go with the projections and forecasting. Initial market advantage allows for rapid uptake and higher adoption rates, especially if there's unmet need. In this case, health policy makers make some distinguished decisions for this initial market to get this initial market advantage on behalf of a pharmaceutical company. And we assume that the initial price benchmark is set, and this influences cost per treated patient and comparative cost scenarios when other competitors enter the market. In the case of biosimilars, first to market biosimilar can reduce costs significantly and influence the price of follow-on entrants. And go with the uptake patterns, and payers may give preferential access to the first product if it addresses an unmet need or it's calculated cost effective, so that cost effective analysis will be combined with budget impact analysis. Early adoption patterns influence the budget forecast, especially high uptake early on, a higher short-term budget impact, or strategic pricing or discounts can mitigate this impact. And there are some static or dynamic models, especially taking into consideration the characteristic of the population. They are static or the dynamic population. The number of patients are stable, or they are reducing or increasing. This is the main distinction of these 2 models. And these models should combined with scenario analysis and sensitivity analysis also. And we get some savings with this budget impact analysis and what to do with the savings. This is important for new therapies. For biosimilars that are first market, significant price drops or reference products, these kinds of savings can be used to reinvestment for new therapies and or expanding access to the disadvantaged patients. This is the example uptake of the new JAK inhibitor versus older biologics. Price premium of the being first and the impact on health budget if it replaces costlier intravenous infusion. And sensitivity analysis will examine impact if a second JAK enters market in year 3 and market erosion for older drugs due to first market dynamics. To conclude, market penetration and adaptation speed and price setting power, competitive landscape assumptions, overall short and medium-term budget estimates. So budget impact models and analysis, especially for chronic inflammatory diseases, where innovation and highly cost new drugs, first market status should be explicitly modeled as a scenario or sensitivity analysis. That's all. Thank you for attending this session. If you have any questions and comments, please feel free to ask and go with your comments.
Okay, thank you very much. Do the audience have any questions to our presenter?
I would like to start with a few questions. When you talk about the payers are the government, right?
Right. Mm-hmm.
Okay. And you talk about the budget impact models. You mentioned that the Netherlands, Belgium, and Canada have applied this BIA, so budget impact analysis. Mm-hmm. Does it reduce? What is the budget for health in this country?
It's important for especially new drugs, new therapies. So if a pharmaceutical company should come to the market with a new therapy, with a new drug, the company should apply the rules of the guidelines of that country for implementing all the details in budget impact analysis.
Okay, so we don't know exactly if this budget impact analysis or these budget impact models are efficient in maintaining a sort of sustainability of the healthcare system. Because in France, the budget for health care system is we have a debt. So it was 12 or 11 billion in 2024 or 2023, and it has become 20 billion. So it is increasing. So I think we need this, the decision to make it the budget sustainable, because it increased dramatically. So maybe we are paying too much, or maybe the prices are so too high. Even in France, I'm not speaking about Serbia. I was last week in Europe, so there was a Serbian rheumatologist, and he said the price is too high, and the agency refused to reimburse some products for rare disease, like
For example, some countries that are in a resource constraint situation, they tend to reimburse not the original drugs, the generic drugs. So this is the main tool and easy tool to reduce the drug-related costs in that country. So if we really need to access new therapy and very expensive therapy, what can we do for patients, for disadvantaged people, especially if the healthcare decision makers decided not to reimburse that drug?
And I can tell you that the rheumatologists are thinking about this because it was one of the topic, the price of the drugs during the last meeting. So, is anyone would like to ask a question to Mehtap?
Yeah. My comment is that new technologies very often born budget constraints, and it could be seen more and more often. Indeed. Okay, do we have any other comments or questions from our audience? I don't see. So I would like to invite you for the next webinar, which will be held on 8th of July this year from 5 to 5:30 p.m. And the speaker will be Przemysław Holko from the Jagiellonian University Medical College from Poland. And the title of the webinar would be Basics of Stochastic Thinking and Markov Modeling. So please register to the next webinar. And thank you for the attending and participating this meeting, and see you at the next webinar next month. Hello,
Thank you,
bye.
brother. Thank you, brother. Thank you all.
Thanks, bye.
Thank you. Bye.
Bye. Have a safe day, safe evening. Bye bye.
Thank you. You're welcome. Bye bye.